I'm Mildred Shaw, a registered nurse, a graduate of Toomey Hospital in Sumter, South Carolina. There was very little to be learned from a book except anatomy, dietetics, basic principles of nursing, and a little bit about drug doses, mostly to break down narcotic doses, since there were very few curative drugs in the world. The majority of our education was on-the-job teaching by our nursing instructors. The difference between what we had to learn and what students have to learn today. What they learn now would have blown our minds. By the same token, the intensive hands-on nursing care that we had to learn would have devastated the present students. There were no IVs dripping. Forced fluids meant a teaspoon or a dropper full of more or less constantly. Blood transfusions were rare and were done in the operating room as a direct procedure from donor to patient. The nearest thing to a respirator was the iron lung for polio victims, and I never saw that used but one time. Bed sores were a sign of very poor nursing care. The majority of our surgery was emergency surgery, very little elective. Admissions to any hospital meant you were in deep trouble. No surgical post-op patients. Most of our patients were really, really sick. The smells and sounds were what nearly did me in. Every smell had a meaning all its own. And I would later learn how important this was. By the time we became seniors, any of us could walk on a hall and tell by the smells just about what type patients were there. In the process of learning these things, we learned how to protect ourselves from disease and infection. In-house, we always had either typhoid, diphtheria, gangrene, active syphilis and gonorrhea, and other infectious things, and there were no antibiotics. Second-year students were isolated with the sickest of these and stayed with them, forcing fluids, sponging, turning, suctioning, until they either died or got well. I never remember any of us getting any of these things. By now it's about Thanksgiving and we are learning more things, one being how to deal with death. There were no doctor rushes. With many illnesses, death was expected and accepted. But no one died alone if that could be avoided, and we sat with the dying. We still didn't have our caps, but we could hold a hand, wipe a face, smooth a pillow. It's impossible to describe how you eventually learn that certain diseases, diabetes for one, diphtheria had a certain crowing sound, not an odor, but a sound, and you had these everyday changes from normal to these that were peculiar to each of the different conditions. There were definite smells and sounds that helped you with your diagnosis. There were no antibiotics. I distinctly remember when penicillin was invented, and they gave a dose to a patient with gonorrhea, and it was like a miracle. She got well like in 24 hours. And we had dodged gonorrhea for 3 years. In my era, you were fanatically clean. Soap and water was all we had to keep from catching things. We did not have a culture lab. We sent it to Charleston to get cultured. So there was no instant knowledge. By the time you got the culture back from Charleston, they were either dead or about. Since you could tell and it could be diagnosed by sound or smell, then that would let you know whether it needed to be isolated or whether it could be on a ward. There was no treatment except cleanliness. Don't call for that covenant. If you were isolated with a patient, you wore a mask and a cap and a gown and gloves. You wore all those things, and you took them off very carefully and put them in the bin. When you came out of the isolation room into a dressing room, and then out of a dirty dressing room into a clean dressing room and out. Disposable things were just absolutely not there. You never threw, and the gloves were rubber, I think. I don't know what they were, but we would take totally ruined gloves and patch the ones that weren't too bad, and you patched them on the inside. Once again, I want to remind you that there were certain things that if you came in with those symptoms, you were given good care for comfort, but not for cure, because there was no cure. You accepted the fact that death was a part of life, and you tried very, very hard, and it didn't matter what color they were, it didn't matter what church they belonged to or anything like that. Somebody sat with the person who was dying, if it was possible. Death was accepted. I don't know how else to describe it.